So I'll discuss some very important points for breast cancer risk reduction. So the most important thing is screening. So the USPSTSF and the United States Preventive Service Task Force recommend screening mammography biennial for women of age 50 to 74 years, but the screening can be started at age 45, and for mm, 45 to 54 years of women, mammogram can be done for every 1 year. So this is why a different professional organization, ASCO, and the 50 to 74 years of age is by USPSTF. So keep in mind that these recommendations apply to asymptomatic women whose age is greater than 40 years and who do not have pre-existing breast cancer or previously diagnosed high-risk breast cancer lesion. Also, they should not have a high-risk genetic mutation such as BRCA1 or BRCA2 or any other cancer syndrome. And the most important thing is increasing age is the most important risk factor for most women. So overall, the 45 is a good age to start screening for breast cancer. And initially, you can get a mammogram every 1 year, but later on, mammogram every 2 years is enough. Now, talking about the high risk patients, so the USPSTF recommends that primary care clinicians assess women with a personal or family history of breast, ovarian, tubal, or peritoneal cancer, or who have an ancestry associated with breast cancer susceptibility 1 and 2. So, this is the name of the high risk gene which are associated with breast cancer with an appropriate brief familial risk assessment tool. So, there are various computer based risk assessment tools which are used to uh, estimate the risk for individuals. So women who have positive result on these risk assessment tools can receive genetic counseling and genetic testing. So there are various kind of tools which are available. So these are used by different tools are used by different providers, but all of them are equally effective. So these are name of the some of the tools. So if unfortunately someone comes out at a high risk zone for breast cancer, then they can undergo BRCA1 and 2 mutation gene testing, which is done by trained healthcare professionals and primary care providers. So, in genetic counseling, first a detailed history is taken for kindred analysis and risk assessment for potentially harmful mutations, and then candidates are further identified to undergo the genetic testing. So, what are the important risk factors which are associated with BRCA gene? So, if you have breast cancer before age 50, or bilateral breast cancer, or both breast and ovary cancer, breast cancer in a male family member. So, breast cancer can occur in males, and which is a high risk factor for other family members also. And Ashkenazi Jewish ancestry, or one or more family members with two primary BRCA related cancer. So, BRCA can not only cause breast cancer but can also cause ovarian cancer and other types of cancer. So, how can you manage risk? So, there are multiple methods of managing risk. One of them is through medication. So, there are different kind of medications, and these are called as endocrine therapy. So, one of them is tamoxifen. So, remember it is useful only for premenopausal women, and it should be used for at least 10 years, uh, or it is beneficial for 10 years. But keep in mind this medication is not recommended for use in women with a history of cardiovascular diseases or deep vein thrombosis or stroke or any if they are not physically very active. So this is not useful in them, and these are useful only in premenopausal women with age greater than 35 years of age, and this is the risk which comes out using a computer algorithm. So this uh, does not need to be memorized. This is known by the healthcare provider who is doing the genetic testing and counseling. Also, it is not recommended uh, for women who are pregnant or who may become pregnant because it is very damaging to the fetus. Another important thing is the tamoxifen drug can itself sometimes cause uh, cancer in the genital tract. So, if the woman who is taking tamoxifen has any episode of vaginal bleeding, then they should immediately report to the doctor. Another drug is raloxifene. So, this is used in postmenopausal women, such as the like tamoxifen, which is used in premenopausal. Raloxifene is used in postmenopausal, and similarly, who are 35 years of age or more. So similarly, this is also not useful if you have history of cardiovascular diseases or thrombotic diseases or stroke, or if you are not very physically active. There are some other drugs such as exemestane and anastrozole. So whether you are the right candidate for them is determined by your healthcare provider. Uh, Another important thing to know about is prophylactic mastectomy. So it is only useful for very high risk patients who also have mutation in BRCA genes, or so not only BRCA genes but high risk otherwise also. So then only mastectomy should be considered. And if someone has radiation to the chest before age of 30 years, so this occurs most likely if someone has had thyroid cancer and have undergone radiation treatment for that. Or sometimes, along with BRCA genes, some people may have mutation in other cancer-causing genes such as TP53 and PTM. So, if these are also present, then prophylactic mastectomy can be considered. Also, these drug anastrozole and can decrease bone mineral density. So, always keep that in mind. So, this is just general information, uh, not a individual. And if you think you may be at high risk, consult your primary care provider or your healthcare professional because this is just a general information and you should seek further advice if you think you may be at high risk. If you want to read more, I have some references attached in the video description.